Many of the top epidemiologists, a lot of your colleagues, Catherine Edwards, Buddy Creech here in Nashville, Dr. Fauci, Dr. Redfield, who I believe is a friend of yours, the country of France, New York, Dutch, they have been so strong about in-person school. And I know, I've read a little bit about how you've said it's a it's a school by school decision, but at some point, there's got to be a data point, right, where you would encourage schools to reopen. And we've really had a very controversial situation in Nashville, not now when it's bad, but earlier in the year when the numbers weren't bad and school never fully reopened in person. And it's really frustrated a lot of parents. And it seems like it's important to a lot of people like you that when we can do this, to do it.
We've learned a lot from schools that did open. We've learned a lot from community colleges and universities that open, that a combination of planning, altering your facilities, clear communication so that expectations are set, and now with aggressive testing, that schools can open and remain open. We've seen this in Europe. We've seen this across many parts of the country. I think for Tennessee right now, they're confronting a virus very similar to the rates in California, really extraordinary increase in cases, hospitalizations, and what follows is fatalities. And so now it's about every Tennessean really changing their behavior to stop the spread of this virus. Every county is dramatically impacted, and we really need to protect each other in Tennessee to get as many Tennesseans to the point where they can get vaccinated as possible.
Yeah, I was going to ask you about that, and because this has come up just coincidentally many times. So California is bad. We traded places with California in per capita cases earlier this week. I think we're number 2 now. I think someone else is number 1, maybe Oklahoma. But so California is very, very restrictive, right at the top of restrictions. And Tennessee is not, right, at all. It's more of a open, on the open end. So how are we in the same boat? Why would we, how are we so close in cases?
I think 2 things matter. It matters how quickly you react to the increased cases with mitigation, because we know now with the level of asymptomatic spread, what we call silent spread, those individuals under 40 who are spreading the virus through gatherings and getting together, unknowingly are spreading the virus to others. And by the time you see it and you mitigate, you're already way into infecting the most vulnerable and them having to be hospitalized. So the mitigations that California is doing now should have an impact over the next couple of weeks, but it will only have an impact if in addition to making the public spaces safe, as the governors and mayors are doing, it's also important for every Californian to do those behavioral changes that they personally need to take responsibility for, of masking, physical distancing, washing your hands, and not gathering past your household. And so in Tennessee's state, what will happen when you don't mitigate as aggressively, the length of time to reach the peak takes longer. And so you infect many more Tennesseans, you have much higher hospitalizations, and in the end, you have many more fatalities. And so mitigation and aggressive mitigation works when you combine it with personal behavioral change that stop the spread of the virus.
There is, and you've seen the polls, there is some reluctance by a large amount of people to get the vaccine. What is your message to them? And also with now almost 4 vaccines on the market, it's hard to imagine that all vaccines are created equal. Not that you or anyone would be in the position of wanting to even say one is superior to the other, but that's also out there as well. 4 different vaccines, are they really all the same? And what do you make of the real reluctance of a large amount of people to have the vaccine?
I think 2 pieces, and you raise really critically important points. One, the Moderna and the Pfizer vaccine are very much alike. And what do I mean by that? They have the same level of efficacy and safety profile. And so they are very similar. The other 2 vaccines that are behind them, we don't have their safety and efficacy data yet. So I don't know if they're going to be similar in how effective and safe they are. That's just data that's still being collected. What I can tell you as our frontline healthcare providers step forward and get vaccinated, we'll have experience across millions of Americans who are really used to understanding symptoms. And they'll be recording and noting if they have any side effects outside of the usual sore arm, potential low-grade fever, or higher fever. They will know, and they will be able to be reassuring, I think, to the rest of the American people that this vaccine is not only safe, but efficacious. And as we get more and more experience, we'll be able to see if there's any of those rare side effects that you may have heard about related to anaphylaxis. We'll be able to see if there's any others like that. And so over the next few weeks, as millions of Americans get vaccinated, I think that will help decrease the vaccine hesitancy, because they'll be able to see that their trusted frontline healthcare workers who have been trying to save their lives for the last 10 months also were protected from infection by getting the vaccine.
How, the things that people wonder about at the dinner table is exactly what percentage of people are dying, and not to diminish age at all, because I'm sure like a lot of people, I have people I love over 70 that are very important to me, but how many healthy people really die of this disease? Do we have those? I mean, at first it was very unclear, but are we clear on those numbers now?
I think you raise a really important question, and CDC did a recent analysis, and there's two ways of looking at this. There's a way to look at certainly people in the younger age groups are less likely to die. And so what percentage of those deaths in that age group are due to COVID? And what we're seeing now in an in-depth analysis is that for anyone over 45, the percent of people dying from COVID of all cause death is fairly consistent across every age group, between 9% and 11%. So although we may have less individuals 45 to 55 dying in general, the proportion dying from COVID is fairly consistent through every single age group. And I think this is really important for Americans to understand. There are young Americans dying from COVID. Yes, they may have diabetes or hypertension, but this is not just about people who live in nursing homes. Yes, they suffered the brunt of fatalities in the March and April timeframe, but they've gotten much better about protecting nursing homes, and now nursing home residents are being immunized. But we have a lot of older Americans in multi-generational households, and we have a lot of Americans with these comorbidities, almost 80 to 100 million Americans. And so you can be young or relatively young and have a fatality from this virus in proportion to the older age groups, just because less people under 55 are dying in general, but the proportion dying from COVID is consistent through the age groups.
And as an overall, you contract the disease, you die from the disease, all populations, all ages, it's still about 1%?
Yeah, if you average everything together, but certainly depending on your comorbidities, you're at much higher risk. Even today, individuals over 75, even with our improved healthcare delivery, which has been remarkable, about 20% of those over 75 are hospitalized, and 10% of all individuals infected with COVID, even with our improvements, are dying from COVID. So this is, at my age, I don't consider someone 75 particularly old.
Right.
So I would say that we have a lot of vibrant and wise Americans dying from COVID that we can prevent by protecting them with mass physical distancing, not gathering, until they can get vaccinated. And they're in 1A, B, or C. So they have the opportunity to get vaccinated over the next 2 to 3 months. We can protect them for 2 to 3 more months after we've been doing it for 10.
And I wanted to go back to schools. You had a great answer on schools. What is there a some point, or do you have any? Is there a data point? Because the problem is every school system is running on different reasons, and it's frustrating to parents. At what point do you go back to hybrid learning, or at what point do you go to in-person? Is there a magic number there for when you get back to in-person school? Because obviously it's devastating, especially in some of these lower income school districts where kids are just dropping out truant left and right, may never recover.
Well, I think it's going to be very difficult for a lot of Americans to recover from this. I mean, there's been a lot of individuals that have been isolated now for 10 months, and that kind of social isolation for children and adults, extraordinarily difficult. The level of anxiety that this has brought out in the American people, just from constant awareness that they can't see this virus and it's infecting others. I think what a very clear guideline can be is you want to see improvement in community spread, and you want to make sure that you can find an outbreak quickly and contain it in a school. And so that's bringing together the community's responsibility to get cases down, which means everybody in the community has to contribute to that by following the guidelines. And at the same time, getting out vaccination and testing so that you're sure that if you find cases, you can immediately stop the spread in that school. That will give everyone the confidence to have their children in school, and critically give the teachers and the janitors and support staff and the individuals feeding our children the confidence to return to school.
Do you see this, not that you're in the business of prognostication, but I mean, people do want some light at the end of the tunnel. Do you see this really starting to steeply decline by March or April, like some have predicted in your community?
What will really be important and what will determine the improvement, both in hospitalizations and fatalities, will be how rapidly the states can immunize those individuals most vulnerable to this disease. And so the choices of who gets immunized when will be critical for determining which individuals in Tennessee survive over this next outbreak. And so really getting those individuals immunized quickly, that's why I'm really pleased that Congress put additional money into states to make vaccines more available. So it's really important to take those vaccines off the shelf and get them into people's arms, because that's what's going to change hospitalizations and fatalities. But I think your question is broader than that. When do you get the children immunized? When do you get the rest of Americans that we know are most likely to be asymptomatic and have mild acute disease immunized? And that is going to take probably through the summer. And so first we have to show that it's safe and efficacious in children. And those studies still need to be done. And then we need to get children immunized. And so that is going to take through the summer. But to get vulnerable teachers immunized, to get individuals over 75 and then over 65 and those with comorbidities immunized, that could happen over the next 2 to 3 months. And that's why we're asking to not only stay vigilant, but let's get those vaccines into people's arms.
One of the criticisms out there, and I know you've heard it, is this idea that the medical community obviously cares about health, but has not done a good job of balancing lives and livelihoods. And that's caused a lot of friction everywhere. How, in your eyes, how do you balance the idea of, protecting lives, but making sure people aren't ruined? Lives and livelihoods.
I've been privileged to travel to many states. I've been to 43, some of them 2 and 3 times. It's very interesting because I see pockets of extraordinary excellence where they've been able to balance that in innovative and creative ways. And what do I mean by that? I was just in Philadelphia and I saw what they were able to do with their restaurants by creating these temporary, well-ventilated, but protected spaces for outdoor dining, where it was warm, but ventilated and really protective. The mayor gave up lanes in their city because their traffic was down. And so these semi-permanent, and they're made out of plywood and plastic structures, allowed restaurants to maintain their almost full indoor capacity outdoors. And I think when you see that, you can see that there are cities and other and small metros and large metros that have really figured out this balance by being creative and innovative and keeping outdoor dining going and outdoor spaces going, as well as retail going. And we've learned from the outbreak over the summer that you can keep retail fully open if you all and have a mask mandate and really physically distance and have your retail. So there are creative ways to balance that. And you can see with the immunizations that that's what the immunization individuals that making those recommendations were trying to really definitively do. Balance those frontline essential workers immunization with those most at risk for hospitalization and fatalities. And that's what we need to continue to do as a country.
Yeah, and you know, that's a really interesting point about Philadelphia, because here in Tennessee and Nashville particularly, I'm sure you know the restricting of restaurants early in the pandemic had some really, I guess there were 3 cases in restaurants ever since March, in June, when they rolled restaurants back to 50%. Hugely controversial, you know, the kind of maybe possible misstep that leads to a lack of trust, whereas Philadelphia, here they are, you know, doing things that make the restaurant people have hope.
Hey, Dennis.
Yeah, no, it was terrific. It was terrific to see. And I see that kind of innovation across the country with people really figuring out how to make their businesses safe so they can continue to be viable. And that has been the exciting part of the travels, of really seeing people make those changes that are both protecting yet business friendly.
Fantastic. Well, I'm a photographer. Kyle, did you have something? Did someone jump in? I heard somebody jump in. Are we out of time? Is that what?
Yeah, we need to wrap up. Thanks, Dennis.
Oh, okay, great. Absolutely handled. Thank you so much for your time. Wonderful answers. Appreciate it.
Great to be with you. Happy holidays.
Happy holidays, Dr. Birx. Thanks again. Bye-bye.
Bye.